Hello. You or a member of your family may have recently been diagnosed with an irregular heartbeat called atrial fibrillation, or AF. This mainly occurs in older people and becomes more common with age. This video will explain what AF is, what will happen next, and the different treatment options available. Normally, your heart's natural pacemaker causes your heart to beat regularly. This makes it a very effective pump. In AF, the natural pacemaker is overridden by random electrical impulses. These impulses cause the heart to pump irregularly, abnormally, and often very fast. This means that the pumping action of the heart can be reduced. If you have AF, your heart rate is usually, but not always, a lot faster than normal. Your heartbeat is irregular. The force of each heartbeat can vary in intensity. The most common cause of AF is high blood pressure. This is because high blood pressure puts extra strain on the heart muscles and affects the natural pacemaker in your heart. Other conditions and situations that may trigger AF include heart problems, an overactive thyroid gland, infection, and drinking lots of alcohol or caffeine. In about 1 in 10 cases, there is no apparent cause and your heart is otherwise fine. If you have atrial fibrillation, you may experience the following symptoms: a thumping heart, also known as palpitations. This is when you become aware of your heart beating. Dizziness, especially when you stand up quickly or bend over. Chest tightness, feeling short of breath, usually on exertion, especially on stairs or inclines. And extreme tiredness. Many people with AF have no symptoms, particularly if their heart rate is not very fast. AF may then be diagnosed by chance when a doctor or nurse feels your pulse. The main complication of AF is the increased risk of having a stroke. This is because AF causes rough and turbulent blood flow in your heart. When blood flow is not smooth, it is more likely to clot. A clot can travel to the brain and become stuck in a small blood vessel. This cuts off the blood supply to part of the brain and causes a stroke. There are different treatment options for atrial fibrillation. Your GP may start your treatment, but may refer you to a heart doctor called a cardiologist or a specialist nurse for advice. Most commonly, you will be treated with 2 types of tablets. The first tablet is for rate control and slows down your heart. A slower heart pumps more efficiently and may improve your symptoms. There are several medications which can slow your heart rate down, and your doctor or nurse will discuss them with you during your appointment. The second medication you may be given is called an anticoagulant, also known as a blood thinner. It does not technically thin the blood, but works by reducing the chance of a blood clot forming, so reducing the risk of a stroke. The most commonly used anticoagulant medicine has been warfarin, although others have recently been developed and are becoming more popular. Your doctor will explain the different types of anticoagulant available and will help you decide on the most appropriate tablet for you. You may also be considered for a procedure known as a cardioversion. This procedure uses an electric current to shock your heart back into a normal rhythm. If you have any further questions, please contact your GP or specialist nurse.